We know that COVID's not going away. There's evidence of ongoing transmission at a community level, particularly the Omicron BA.2 subvariant. It's also clear that immunity against SARS-CoV-2 wanes after the first booster dose after approximately 4 months. There's also data to tell us that a fourth dose is beneficial as it provides additional protection for specific vulnerable groups. So, ahead of winter, the Australian Technical Advisory Group for Immunisation has recommended an additional booster, or a winter booster, is delivered to populations that are at greatest risk of severe disease. Importantly, it's recommended that the COVID booster vaccine can be delivered at the same time as the annual influenza vaccine. We know that this is safe and effective, and importantly, it's likely to be convenient for Australians and for vaccine providers, given people will be able to rock up, roll up both sleeves and have it done at the same time. So this will be available from early April 2022. There is currently insufficient evidence to recommend an additional booster for other population groups. This is, however, one of the critical questions moving forward. That is, will periodic boosting be necessary for all Australians or just targeted to specific vulnerable groups, such as those suggested for a winter booster recently by ATAGI? Here at the Telethon Kids Institute, we're really excited to be leading the Peekaboo trial, which is a trial that will evaluate the best booster strategies for adult Australians. We hope that the new knowledge generated by this trial will help policymakers determine whether additional boosters are needed for other population groups. Some countries are already recommending boosters for adolescents, including the United States of America, Israel and Germany. Currently, policymakers in Australia are awaiting further evidence to determine whether the risks of delivering vaccine to children and adolescents outweigh the potential benefits for this group. We know that children suffer milder disease compared to adults, but importantly for children there have been severe consequences as a result of the indirect impacts of COVID. These include disruptions to healthcare, disruptions to education, recreation, and also the ability of our kids to connect with peers and other community members, which we know impacts on mental health.